Thank you very much. I have to say, let's give a round of applause to Ella. She's doing a great job emceeing the event. Yeah, and of course, thank you very much for everyone, the Molecule team, to put together this event for the third time. And the reality is, like, this event has been very pivotal in the BioDAO ecosystem, but also for AthenaDAO. And I will tell you a little bit about that in the next slides. So I'm the ops lead at AthenaDAO. I have been involved since the very beginning, actually since DeSci Berlin 2022. And what we are trying to do here and what we are building is the leading decentralized community for translational women's health research, education, and funding. So we are scouting, we are funding, we are incubating, we are translating women's health research projects. And there's a lot I will talk a little bit about what we are doing, why we are doing it, but I can tell you that something that I realized over these past 2 years is that the opportunity in the women's health space is actually much bigger than we initially thought. There's much more to do that probably we initially envisioned. And if anything, these past 2 years really reinforced the need for a DAO in this ecosystem, in this space. And again, we are very, very excited to what we can build going forward. So a little bit on the problem. I think a lot of you already have seen us talk about the data gap, the funding gap, and the market gap. So basically, there's not enough information, data in the women's health research. Women were not part of clinical trials. There are drugs in the market that were never tested in women. And the reality is, like, for many years, we thought like women were just like smaller versions of men. But we now know we're actually very different to our core, right? So we really need more data in the space if we want to build more companies, more therapeuticals going forward. There is also a funding gap. Not enough money goes into funding women's health specific conditions. And this is like across the board, from the NIH grants to, of course, biopharma is definitely not putting enough money into it. A lot of times, funny enough, even though the women are the biggest consumer market, a lot of times people come to me and say, like, women's health is such a niche. But it's a niche of half of the world's population, right? So I'm not sure how other niches you have that are as big. So as I can tell you, like, and not only that, women make 80% of the medical decisions in a household. So we actually make the decisions in terms of healthcare. And so I think that makes not a niche, but actually a quite big market. And every 6 months, we are lucky because McKinsey, the World Economic Forum, and others come with a new reports saying how actually big the opportunity is. This is from January, where McKinsey said that this is $1 trillion opportunity to improve lives and economies. So again, it's not just us saying this, it's actually other organizations, you might like them or not, but they are actually saying the same, that there's actually a big opportunity, a big market here. So, but what actually have we done, and basically what is the path that we are taking here? And I'm going to tell you a little bit of the story of AthenaDAO. I think over the past 2 years, and of course that it's normal, we spend a lot of time projecting the future, right? And today I will do a little bit of that also in my talk. But I also want to tell you a little bit what actually we have done to get here, where everything started, because the reality is, like, we didn't start it too much a lot of time ago, right? We started 2 years ago, exactly more or less around this time, in DeSci Berlin, not far away from here, where a group of women came together and realized that it made sense for us to build something in women's health space. We have to thank Beata that is there, because she was the one that put us together in the same room, so thank you very much for that. And the reality is that the fact that we were there, for us it was very, very clear the opportunity was there. For us it was also very clear that DeSci looked very exciting for us to make an impact in that space. Since then, of course, we launched in August. We joined the BioXYZ Accelerator later in September. And then we launched our first call for projects later in the year with a focus on ovarian aging. And this is a place where we're actually quite different from other DAOs. We take a cohort-based approach. Women's health, again, is very, very big, and there's basically a lot of areas of research. So what we decided to do was to focus on specific areas every 3 to 4 months. So we launched with a very engaging and a call for submissions. We got submissions from the National University of Singapore, Oxford University, and others. And we could basically see from the get-go that our problem wouldn't be sourcing projects. Our problem would be having enough research, enough funds to actually helping and supporting these projects. We kept going. We funded our first IP NFT, and then, this is actually my old presentation. And we funded our first IP NFT. Then we launched another call focused on basically endometriosis and PCOS. We basically, and in September last year, around DeSci Berlin, we decided to launch our second our token. And basically that was, again, a very important moment for us. It would allow us to get resources to keep going and to keep developing what we are trying to achieve here. Later in the year, we also funded our second IP NFT. I will talk a little bit more about them later. But our story keeps going, right? Basically, we then made our token available on Uniswap. We launched our first entrepreneur in residence position, and that was actually very interesting. What we wanted to understand is like, if people out there were actually interested in working with us, in taking this research to market, and we could see that was definitely the case. We got applications from all around the world, from investors, operators, and previous founders that were very passionate about women's health and really wanted to work with AthenaDAO to take our research to market. Then later on, in March, we actually did our first AthenaDAO summit. And basically that was actually a great way for us to bring leading researchers to Cascais in Portugal, where we were discussing basically roadmapping the future of women's health. Something that was very interesting that came out of this summit was the fact that there was a lot of collaboration, a lot of conversations, and we are now seeing the results of those collaborations, where some of the researchers that didn't know each other or knew each other's work but not necessarily have met are now working together, and are now working together even more with AthenaDAO, and that's very exciting. More recently, as I was mentioning, we work in cohorts. So we launched our gynecological cancers call for submissions. More recently, we are now in the evaluation process. We also got very exciting research. We are available on Base, and very recently we have a partnership with Research Hub where we funded 3 preprints on hormonal health, and we also launched the Student Leader Awards to support the next generation of researchers in women's health. For you to have an idea, because of the lack of interest and the lack of funding in women's health research, and a lot of the times researchers, when they have to make a decision of where to go, they actually don't pick the area of women's health. And that's something that by doing these kind of collaborations, we really want to incentivize more great researchers to go into the space, because we believe, as I already made clear, there's a lot of opportunities here. And we were doing this while also onboarding the next generation of Web3 members and contributors, right? We have done a lot of in-person events all around the world. We have one happening on Sunday in São Paulo, a breakfast. We have been part of a lot of conversations to really onboard women into Web3. And something that we have continuously heard is how they get so excited about women's health, how they see this is also an opportunity for them. Because maybe before they could not see how their interests would align with Web3, but now, because of AthenaDAO, they actually do. But what we focus, and a lot of our work is focused on the science. And these are our 2 first IP NFTs. One is from Mario Cordero from the University of Seville in Spain. We have actually very interesting results coming in. So we have, basically the project has been accelerated, so hopefully we'll soon have some news to share with you. And then we have Dr. Joshua Johnson in the University in Colorado that is also working with us. Something Something that we are also seeing for the first time, and again, this takes time, right? I think we are all very impatient about like what we want to see and when we want to see it. But something that we are also seeing is that researchers that have worked with us, for example, in the IP NFTs, also bringing us other opportunities. So what we are seeing is like this flywheel is actually starting to move a little bit faster because also the researchers are our best ambassadors out there, and they see the value that as a DAO we can bring. They see the value of our contributors and what we can bring to the table. And now what we are seeing is that they really are bringing us opportunities to work with them. As I was mentioning, we funded these preprints with the Research Hub. We could see like how much value there is in the research that they have done. So basically, that like there's a lot of like very amazing research out there, and this is also an opportunity to fund that research very early in the stage. And we are also very excited to have the Student Leaders Award, some of them coming from some of the best research labs in the world, working with some of the best, most well-known researchers in the space. And now we are incentivizing them to keep going and to focus on women's health. We are sharing in these days a little bit of more like biographic information about each one of them. And this morning I was reading and I was like already so impressed. They are so young, but they have already won like very well-known awards. They already are doing a lot of research. And basically in the end, we are also onboarding them into Web3 very early in their career. So we see that also an opportunity for us. And all of this has been done by a core and alpha team that has been growing, changing over the past 2 years. We are lucky because it's amazing the quality of the researchers that are coming to us, wanting to collaborate with us in the women's health space. They are very passionate about it. So I think that's really amazing. We have much more contributors, of course. So I couldn't put all of them here. Eileen is there and she's laughing a lot. But if you want to talk to her about what it means to actually work with the AthenaDAO team, please go talk to her. And also, we are building this network of advisors and leaders in the space that are really that really show like how much we can do here. So what's coming next? So as I was mentioning, we work in cohorts. We are very excited now that the next cohort will be on deep tech, reprotech, including the artificially wound, assisted reproductive technology, and in vitro gametogenosis. So there's a lot we want to do here, and I think this is going to be a very special launch for us, so keep an eye out. We are also working, and we have a lot, like, as I was mentioning, like there's no lack of amazing projects for us to work with. So we have 14 IP NFTs, including collaborations in the pipeline, 4 IPTs. We have 5 startups that have, like, with who we are basically co-building, and a data platform that we are now working on that will be quite exciting. So if you want to learn more about us, please feel free to talk to me. Feel free to talk to Eileen. We have a slide that I wanted to show you. Unfortunately, I won't be able to, but we are working also this weekend. We will be launching something very, very special. So make sure that you keep an eye out for our Twitter. And yeah, I'm very excited to be here. And basically, we are a result of bringing people together, talking about science, some of the challenges, but also collaborating and brainstorming about what we can do together to change, in our case, women's health, but to change science in general. So thank you, and yeah.